Our times, we were not told this is for competency based or this based or everything was competence. Because we had 2 years, that has to be considered also. You all are having 9 months. 3 months তো সব কিছু হলো, কিন্তু করতে হবে, নাচটাও করতে হবে, প্রেমও করতে হবে। বাংলা বুঝছিস? হ্যাঁ, ইউ আন্ডারস্ট্যান্ড? ঠিক আছে। তো you have to be on a date, you have to be on a candlelight dinner, everything you have to do. Today you have to go for a outing, and please see the identify side. Which side? A lung, right lung, left lung. Now, external features and relations of structures which from root of the lung and bronchial tree and their clinical correlation. Mention blood supply, lymphatic drainage and nerve supply of the lungs. Clear? Now, these are the main content of the your, that can be in theory, it can be in your practicals. To me, if you pick up the 2 visceras will be there, right lung, left lung will be there in the tray. It won't be not that, see, whatever will be set up in the practicals, I am talking now practicals. Now that will be set up according to, not only 1 lung will be placed. There are 2 lungs. There will be heart. There will be a heart as a whole, and there is a heart with cut, which is cut open. You can see the inner surface of the heart. You can see the inner surface of the heart. What are the features inside, and what are the most important things in the valves? Now, heart has 4 chambers. Okay. Now, just like that, it will be questioned. Now see, introduction. Describe the right lung under following headings: borders, surfaces, fissures, lobes, impressions and applied anatomy. Now you can see lungs or pulmons, vital organs of respiration. Practical means dekhi dilo to, what is happening, what is your block is this is the block, it is your mental block. To dekhe nilam, ota hoye gelo. But what I am saying, after the teacher shows you, demonstrates to you and goes to his for a cup of coffee or anything, or some official work, seeing something, now he leaves you and you are amongst yourself. Now you take up a book, you open the atlas and start in group. দেখবে তুমি আজ থেকে প্র্যাকটিস করো, দেখো তোমরা, you will generate some knowledge, you will be fulfilled with some. এই তুই তো সোয়েটার কোথায় কেন এত? একটা ছেলে দিল্লিতে ছিল আমার, হি ইজ আ টেনেন্ট, এই ডিসেম্বরে খালি গায়ে থাকতো, and he used to at 4 AM he would be in this thing in the roof and exercising. He was from Himachal. No, he was from your Mussoorie, Dehradun. Now, see, lungs or pulmons, vital organs of respiration. Now, situated in thoracic cavity. Now, you pick up a lung. What is this organ? You will say lung. Which side? Right and left. Where it is located? Don't say abdomen. Don't say abdomen, it's in the thorax. Okay. Now, covered by pleural sac. It is covered by pleural sac. It is spongy, because if you see the when you do the microanatomy or these lungs, there's the alveoli. It's a single epithelial layer. Now it is in groups in the bronchopulmonary segments. When you will, that will be a lecture on this thing. Now, one thing, covered by pleural sac. Main function of lung, the oxygenation of blood, gaseous exchange. Main function of lung, oxygenation of blood, gaseous exchange. Space between right and left lung sac, pleural sac are called mediastinum. The space. Now the right lung is here, left lung is here. Now the space between these two is known as mediastinum. You have read sternum. You have read the thoracic cage. Now, now see the right lung. The pleura, see the blue is the pleura of the left lung covering. See this the pleura. This is the place space for the heart, and you can see the pleura. Now this is the sternum. This is the costal cartilage, ribs. Now you see features of the lung. The features of the lung. What are the features? Two lungs, right and left. Shape pyramidal and conical. Pyramid, conical. Now weight. Right lung weighs 700 grams, slightly heavier than the left lung, 650 grams. Color rosy pink. Now, if whatever you see in the dead body or here, it is not rosy pink. It's not rosy pink. And rosy pink you want to see, it should be a fresh dead body. Or you open up any YouTube and see the any operation on lungs or this thing, you will see pink. If at all you cannot see at YouTube, you ask your mom to, you will go to the mutton shop and go to the meat shop or to buy for your biryani mutton. Okay. Then you ask the person who is doing push ta debe, the lung ta dekhao. Okay. He will show you the trachea and the both lungs. And it's pink. And what they do is jumble up, the soft with liver they mix with and extra weight. But few people, they buy the pink colored lungs also to prepare some dish. Now on exposure, pollution and smoke, lungs become brown to black, texture spongy. Texture is spongy. Okay. Feel it. You see you are having a lifetime only seeing a dead body once you are in anatomy. That's why I've written your anatomy is your gateway to medicine. ठीक है समझे? Or see it is spongy. I'll just show you. Now see the horizontal fissure and this is the oblique fissure. Horizontal fissure and oblique fissure and this is the oblique fissure. Then this divides 1, 2, 3, 3 lobes, right side. Ekdam easy. And left 2 lobes. So once you pick up the lung in a practicals, you hold it in anatomical position, anterior border, posterior border. Now it is contoured. I'll show you, and having the external surface as there will be impression of the. You see the lung is here. Then there is impression. The ribs have an impression. You have it. You can see it there. Okay. Now. This is the trachea, see oblique, this is the base, apex up like a pyramid, a posterior border, inferior border, and this is the oblique fissure. This is the cardiac notch. The heart is placed here. Now right lung, left lung, anterior view. Now clinical integration. Dosimetria test, lung flow test. After autopsy, lung kept in the bucket of water. Individual who has taken breath air present in the lung alveoli and such lungs float in water. This test is useful in forensic medicine. Differentiates stillborn from live-born babies. Now, if a fetus and stillborn baby without signs of life, lungs sink in water, whereas in live-born babies float, lungs float in this thing. Now, if a baby is born, it is found in the pond or some tank or something like that, then that is in autopsy. Autopsy means forensic, the post-mortem. They take up and they test. Okay. Now, this can come as a short note or in the MCQ. Now, see, features of the lungs, shape conical, weight 700 right lung, 650 grams in left lung, rosy pink, brown, black, texture spongy, presenting parts, apex, blunt, lies on the root of the neck, base, concave, rests on the diaphragm, and borders, anterior thin, cardiac notch on left, posterior round, ill-defined, inferior semilunar. Now, costal, smooth, convex, related to ribs, medial, anterior mediastinal part, posterior vertebral part, inferior diaphragmatic part. Posterior vertebra. And here's the diaphragm like this. It is, you will see, now external features of the lung, apex, upper end, base, lower concave surface, three borders, anterior, posterior, and inferior, and two surfaces, costal and mediastinal, fissures, horizontal and oblique, on right and only on, oblique in the left, it is horizontal and oblique on the right and only oblique on the left. Lobes on right, superior, middle and inferior, and on the left, superior and inferior. Okay. Now you can see features of the lung, shape conical, weight 700 grams. It's a repetition again. So, apex blunt lies on the root of the neck, base concave rests on the diaphragm, borders anterior thin, cardiac notch on left, posterior round and ill-defined, inferior semilunar, surfaces costal smooth, convex, related to ribs, radial, anterior medial part, and vertebral part, and inferior diaphragmatic part. Now what I want to say is this, that when you go home today, the practicals which you are attending, in the first, you go home, take one power nap. Phone switch off kar do, sab kuch kar do, power nap le lo. Get up, have a coffee or tea, whatever it is, wash up, and you put a, if you are you want to hear some music, you hear some music, sit down and just silence 10 minutes. Then you just go through the practicals which you have done in the respective subjects. I'm talking about the biochemistry, physiology, and also your anatomy. You just go through it. Now you take up the book, then come just for half an hour. You come together, your friend, your roommate, whatever it is, which is you're comfortable with. And after having your dinner, you sit for anatomy. In this 7 to these 3 hours, you do biochemistry, physiology, every day. This 8 months you don't, please. And in the hall, if whoever teaches you or shows you some subject or slide, oh, হয়ে গেছে, no, হয়নি। আমি যেটা বারবার বলছি, তোমরা এবার যে হিস্টোলজি গুলো তোমাদের হয়ে গেছে, Avinash is always there to cooperate with you. You can ask him and show to place this thing during the histology period. and you sit down and see. Division টা করে নাও. Whatever you have gone through, that is the superior extremity, and now we are having thorax. Inferior extremity is done. No. তাহলে দুটো, তারপরে তো টেস্ট হবে একটা. হ্যাঁ. So start preparing for your exam. It should be a continuous process. Saturday evening go out if you like. If you don't like, call Zomato or Swiggy, whatever it is, you get your food here. Okay. Now, this is one thing I tell you. You please, there are many colleges in India. They don't have any patient. जब इंस्पेक्शन होगा तो बाहर से आदमी को लाके ग्रीन ड्रेस पहना के सुला दिया. And you are lucky, the first batch also, the very first day you are seeing a dead body, you are seeing visceras, a complete department. And you ask, these people are not your, this thing, Shatru. Shatru means enemy. They are very cooperative, they are gentlemen. They are not rowdies. So, one thing is that this is the everyday last resolution I am telling you. From January, I won't speak on this context. আমি promise করেছি নিজের কাছে. I have promised that I won't, because you are not a baby. Your generation is more intelligent than us. Then why not you do something great? And main thing, you are having books, tools, everything. Okay? Now, please just, how many of you were there? Just 5 come. 8 or 9. This is a small lung. It is like this. There's 1, 2 lobes. Okay? Now, you see this rounded portion, posterior. And this is the anterior border. This is the inferior border. Now, heart is here. See the contour. At a common sense, the contour, the heart is like this. And this is the hilum. ঠিক আছে, এটা ভুল হবে না, হওয়া উচিত নয়. এই ওখানে কোনো থোরাক্স কাটা আছে? যাই হোক, ওরা দেখবে, ওরা তো ডিসেকশন দেখাবে. আজকে আইডেন্টিফিকেশন করো, দিয়ে নেক্সট উইকে যখন আসবে এটা পড়ে নেবে. Then you ask for lungs. I'll be teaching you heart and lung. Now you see it in this mode. You study in this mode. আর হাত ফাত ছেড়ে করতে হবে. মানে you have to touch, feel. Otherwise, if you not, a dead body also, if you are called for to see your patient, you have been seeing that patient, you just have to feel the pulse. They have put the, in Hindu culture, there is some people, and they put tulsi left lung. This is on the right side. Imagine the palm of the hand is the diaphragm. This is the diaphragmatic surface. This is the apex. It's a pyramidal structure. Okay. কি ভাবছিস বাড়ি যাবি? কোথায় বাড়ি? হ্যাঁ, কোথায়? জগন্নাথ মন্দির. ওকে. নিউ দীঘা না ওল্ড দীঘা? না, দীঘার ওল্ড দীঘার নিউ দীঘা আছে. Now you can see the tracheas. Now you see the borders, blunt. These are sharp. because of the the contour of the contour that protects the thoracic cage, protects the your lung from any injury or the thing. Get it? Now, one thing is this. See, this is one fissure, two lobes, left side, left side, left side. Okay. Now you can see this is the lingula, and this is the cavity like this, and see the difference between the now see this. This lingula, the heart is placed here, quite big. Okay. It's like this. It won't be like this, but it will be like this. This is the diaphragmatic surface of the heart. It has 4 chambers. That you know. That I won't be saying. But I will be saying. এবার আমি কথা বলতে ভালোবাসি, চুপ থাকতে পারি না। এবার এত কথা বলি যে আমার মেয়েরা বলতো তুমি এত কথা বলো, তবে যখন চুপ হয়ে যাচ্ছি তখন তারা বলছে তোর কি হয়েছে কি হয়েছে। তো জাস্ট সেই দ্যাট ভগবান কথা বলে না, কিন্তু আমি একজন মানুষ তো ডাক্তার, আমি কথা বলবো। আর আজকালকার ডাক্তার আবার কথাই বলে না, 2000 টাকা ফি নিয়ে খসখস প্রেসক্রিপশন লিখতে লাগে। Now, this is the total, the difference between the things. These will be asked by you. There are some impressions you will read. You have any difficulty, it will be when they open the thorax, when you see the arch of the aorta and all this, head and neck, the carotid arteries, then the nerves, the right phrenic nerve, left phrenic nerve, and the left recurrent laryngeal nerve that hooks and goes ascending. Actually, these things, এটা just মানে একটা ক্রাউড আমি বললাম এটা আমি চাইছি যে তোরা দেখে নে, আর ওই যে 15 মিনিট টাইম পাবি, ঘড়ি দেখবি না। হ্যাঁ, এটা এখন কটা বাজে? 12টা 15। 45 minutes you just rattle, বই খুলে নাও, দেখে নাও, এক এক করে নিজেরা হাত ধরো, আরে কিছু হবে না। ফরমালিন সব জার্মস, HIV, STD, এভরিথিং ইজ গন, so don't fear. হ্যাঁ, leprosy, ঠিক আছে, এনিথিং ইজ দেয়ার, ডোন্ট ফিয়ার, তাহলে তুমি ডাক্তারি করতে পারবে না। ঠিক আছে, নাও এগুলো দেখো। আজকে ক্লাস এটা হলো, নেক্সট দিন আমি ঠিক হার্টটাকে ঢুকিয়ে নেব। ঠিক আছে, কারণ আর একটা তোমাদের বন্ধু বান্ধবরা আসেনি, হ্যাঁ, তাদের সাথেই আমি হার্ট আগে বলবো, তারপরে ওদেরকে লাং দেখিয়ে দেবো। তখন তোমরা কি করবে, তোমাদের যাদের লাংটা সরগড় হয়নি, তুমি আরেকবার দেখে নেবে। শোনো, অবিনাশকে জিজ্ঞেস করে নেবে, ও 4টের পরে মানে ডিসেকশন হলে অ্যাক্সেস করতে দেবে না, বাট ইউ হ্যাভ টু কাম ইন গ্রুপস। If you want, you can want to see a specimen or your bone, but you have to come in 4 groups, 4 জন করে এসে দেখে চলে যাবে। ডেড বডি যখন বার করবে, তোমার আরেকবার ধরো আপার লিম্বটা তুমি রিভিশন করতে চাইছো, ধরো হিস্টোলজি হয়ে গেছে, দেখে নিলে তখন আপার লিম্বটা এসে দেখে নিলে, অস্পিক